Good morning, everyone, and happy Father's Day, happy Juneteenth to everyone, especially to fathers, father figures, grandfathers. Again, my name is Fred Korley, and I'm an emergency physician, and I was asked to talk about essentials for better health. And so this talk is going to be, a summary of things that I think can lead to improved health, because as we already know, for men, and especially for Black men, but for men in general, longevity is always lower than for females. And especially for Black men, even education does not change that difference. And so, as a group, there are things that, we could do better to improve, our longevity. And this is a summary of things that, I came up with based on my clinical practice and also based on what is available in the literature. So the first thing I want to talk about, and frankly, I'm not going to get too much into it, is, get vaccinated. I am hoping that everyone on the call has been vaccinated. And if you haven't been and you're still, hesitating because, you have some questions, I encourage you to send me an email if you want to talk. I am going to leave my email in the chat. But I do feel very passionately that, we have significant evidence to show that, these vaccines are safe and they're important. And so everyone needs to get vaccinated. And by vaccinated, obviously, I mean vaccinated against COVID. So Eric, I know you're going to talk about mental health, and I'm going to try, not to talk a whole lot about mental health, but I think this is a big problem. I think that if you look at reasons why, especially Black men, do not live long, increasingly, we're recognizing that one of the important risk factors is mental health. It is the management or mismanagement of stress and untreated mental health issues. And if you don't believe it, just think about how many couples where after one partner dies, the other one follows very quickly. And you ask yourself, why does that happen? And there have been a number of different studies that have looked at the association between mental health and cardiovascular disease. And they are both physiological pathways, meaning that these are true biological pathways by which mental health causes heart disease. And there are also some behavioral pathways, and they sort of feed into each other. So when you have anxiety and depression and chronic stress, sometimes that leads to a lot of pain, increased cardiac activity, reduced blood flow to the heart, increased cortisol level, which does a lot of bad things because it causes a lot of inflammation that can cause blockage in the blood vessels of your heart. So, untreated mental health issues, actually can lead to heart disease. In addition to that, untreated mental health issues can also lead to behavioral changes that worsen heart disease. Because, for example, when you're depressed, you're less likely to take medications, and you're more likely to engage in activities that are injurious to your health, like smoking and inactivity. And again, that's all I'm going to say about it. I know Eric is going to probably talk a whole lot more about mental health, but I do want to just stress the fact that mental health is related to cardiovascular health, and it's really important to make sure that you're taking good care of your mental health. A couple of weeks ago, I was working in the emergency department, and I took care of a lady who came in for chest pain. And as I started talking to her, and talking about her medical history, I realized that she had had a history of breast cancer, lung cancer, and ovarian cancer, and pretty much all the organs we have. She had had some sort of cancer in them, and she was in her 70s. She looked great. And then I started asking her, how come you're doing so well and you've been through so much? And I suggested, is it because your cancers were caught early? And she said, yes, I don't play. Anytime I feel something, I go get it checked. Increasingly, I'm beginning to think that the squeaky wheel gets the grease. That those who are less likely to postpone the problems they have and who are more likely to take action. You start having chest pain and you want to get it checked. Those are the people who end up doing better in my mind. Because the truth is, if you call your doctor on the phone and you say, I have chest pain, there is absolutely no way they can tell over the phone whether this chest pain is caused by a heart attack or not. And I've known this because I've done a ton of research in diagnosing heart attack. And the truth is, patient's history, the stories people tell us, is just not reliable enough. The only way to know is if you do objective testing. And so it's important that when you have any kind of symptoms that are new and different to you, you get that checked because, the only way to know that it's nothing life-threatening is if some objective tests are done to make sure. And it's also important that you have regular checkups because sometimes there are things going on that may not yet surface to the level of clinical symptoms, but when your doctors do routine exams, they may be able to figure it out. And by far, for almost all diseases, detecting it early increases your chance of survival than detecting it late. So next, I want to talk about eating a healthy diet. And these are recommendations from the American Heart Association. And I think you all know about eating a healthy diet. There are a few things I want to highlight, but I'm going to start off with my second point, which will be reading nutrition labels. That is something that I think the vast majority of us ignore, but sometimes you'll be surprised when you read the nutrition labels. And for example, you look at the sodium content. And I think that it's just critically important to just get into the habit of understanding, what it is that you're eating. The American Heart Association recommends that, we eat lots of fruits and vegetables, whole grains, lean animal proteins, skinless poultry and fish. And they also recommend, limiting sweetened drinks and processed meats and refined carbohydrates. A lot of these things are probably things you're already aware of. I think that, it's okay to give yourself a holiday occasionally, but we have to be intentional with our diet. We need to make sure that, we are improving our chances of longevity by being intentional with our diet and making sure we're putting in our bodies things that are going to help us live long and not things that are going to end up harming us. Next, I want to talk about exercise. And to talk a little bit more about this, I want to show you some data. So there was a study that looked at the association between push-up exercise activity and future cardiovascular health amongst active adults. So here's what they did. So they took a bunch of adult men and then they looked to see how many push-ups they could do. And then they followed them up to see who is going to develop heart disease. So here's what they did. They followed these people up for 10 years. And they broke up the number of push-ups you could do into 0 to 10, 11 to 20, 21 to 30, 31 to 40, and greater than 41. So here's what they found. So for those who could do 0 to 10 push-ups, about 11% of the 10.5% died over the next 10 years. What do you think happened to those who could do 10 to 20 push-ups? The proportion that died was significantly lower. This was around 4.5%. And then those who could do 21 to 30 push-ups, they had some additional benefit, about 2%. And then, for those who were 31 to 40, they were, a little bit higher than the 21 to 30. But the truth is that, the differences were not particularly significant. And anytime, you do studies like this, there may be a slight change, that may not be statistically significant. And then here are the overachievers. I mean, I don't know how many of you are able to do greater than 41, but that is the overachiever group, and not everybody can be here. But if you look at between 10 to 20, 21 to 30, and 31 to 40, they're all pretty much the same, but definitely better, significantly better than the 0 to 10. So you don't necessarily have to be an overachiever, but you have to do something, because something is better than nothing. And exercising is very important. I hope that people don't take away from this the fact that you have to do push-ups per se, but this is more about just doing some sort of exercising. And to make that point even more, this is a study that looked at walking. And so they looked at how many steps women took, and looked at the association between the number of steps they took and all-cause mortality. And again, I'm going to show you the data. Here, they follow these women for up to 4 years. And they broke the number of steps they took into 4 different categories, almost 3,000, a little over 4,000, about 6,000, and about 8,000 steps per day. And again, number that died, about 6% in the almost 3,000 group, significantly lower in those who could do 4,000 steps. Similarly, those who could do about 6,000 steps, a little bit better, but the difference is not particularly significant. And then 8,000 steps, again, a little bit better, but not particularly significant. So 2 different studies, both published in very high impact journals in the medical community, saying similar things. That if you're exercising, again, it's not the particular type of exercise, but if you're exercising, those who do a good amount of exercise end up doing better no matter what. There is some dose dependent benefit where those who are doing more benefit more, but there's a huge drop in mortality amongst those who don't do a whole lot versus those who are doing something. I also want to talk about sleep. This is something I did not know a whole lot about until recently. And, because I do a lot of work with brain injury, we looked at brain proteins that are released into the bloodstream when brain cells die. And lately, we have noticed that essentially when you sleep, the brain takes out the trash during your sleep. So during the day, as your brain works, it accumulates essentially trash. And at nighttime, that's when the brain cleans this trash up. And so for those who do not sleep well, you end up accumulating a fair amount of trash in the brain, which ends up causing problems, including dementia, memory difficulties, so on. And so, good sleep, especially, uninterrupted sleep, having sufficient amount of REM and deep sleep are critically important to your health, to your brain health, because again, you clean up your brain at nighttime. And so if you are having challenges with sleeping, it's really important to talk to your doctor about it, because for some people, it may be that you have sleep apnea. and once that is fixed, or once you are on a machine that can help you breathe better at night, you may be able to sleep better. For some people, it may be mental health issues, and getting that fixed can allow you to have improved sleep. Whatever it is, make sure you get help. But sleep is really important, and especially for cognitive health. And towards the end, I do want to talk about controlling blood pressure. There's something that is really important to me because I have high blood pressure. I eat really well. I exercise all the time. I still have high blood pressure. And for some of us, that's how we're made, and it is what it is. But it's important to control your blood pressure, because when you don't, it causes a lot of other end organ damage, and which completely reduces your quality of life and your longevity. I do want to stress the fact that normal blood pressure is a systolic of 120 or less, and that even if your blood pressure is 140 systolic, there are people who think that that is fine, but it's a lot of studies have shown that when your blood pressure is pushed a little bit lower, that helps improve your cardiovascular health, prevents things like kidney failure, reduces risk of stroke, and so on. And I do know that for a lot of people, what turns them off in terms of treating their blood pressure is the fact that some of these medications have side effects. And the good news is that there are a whole lot of different classes of medications. And so if you have side effects to one of them, you can work with your doctor to find, other medications, that would work for you. And so it's really important, to get blood pressure under control. And the last thing I'm going to mention is that work with your doctor, but you take charge of your health, because no one is as invested in your health as much as you are. And doctors are well-meaning people, but a lot of times people just don't pay attention. And so it's important that you have to take charge of your health. And if you feel like you are not in the position to be able to advocate for your health, when you're seeing your doctor, take someone with you who can be that advocate for you. But it's really important that you take charge of your health, and you make sure that you're getting the treatment you think that you need. And with that, I'm going to stop and take questions at the end.